Hi, this is Dr. Hitesh Kubadia. I'm an orthopedic and a joint replacement surgeon specializing in minimally invasive joint replacement surgeries using the muscle sparing approach. I also do a lot of partial knee replacements, that is called the unicompartmental knee replacements, which is the next thing in trying to preserve as much as natural tissue as possible. I am here to explain something about osteoarthritis of the knee, which is a very common problem faced by a lot of our elderly population, and it disables them in their day-to-day life. If you these are small models of the knee here, so that I can explain it to you all and you all can understand what is the actual problem here. Now if you look at this is a knee model. So if you look at, the knee is made up of a lower portion of the femur and the upper portion of the tibia. So this is covered by a cartilage here. This blue thing which is marked up here is the cartilage, and this is a very smooth glistening surface which allows for frictionless movements across the knee. Okay, as we age, as we create strains in these cartilages develop some bumps in their surfaces. So this surface doesn't become as smooth as it once was. As we age, as the friction keeps on increasing over a period of time, this gets worn out completely, so much so that the underlying bone starts getting visible, and this causes tremendous friction on your movements and causes pain. As people still pull on, and then what happens is all the three compartments of the knee, the medial compartment, the lateral compartment and the front compartment, the inner compartment, the outer compartment and the compartment which is in the front, all get worn out. So this causes pain and disability and pain for the patient, and affects their day-to-day activities of life. Osteoarthritis has various forms of treatment. Initially everything is non-surgical, so when you try all those non-surgical methods to give relief so that your life continues with a lot of smooth and ease. But when these non-surgical methods like injections in the knee or physical therapy and injections in the knee start failing to give you enough relief, then we need to think about surgical options. So when we see on an X-ray and clinically when we examine the patient and we see is only one compartment of the knee which is damaged and the other part of the knee is very healthy, it makes sense to do only, change only that compartment of the knee which is actually causing the problem for the patient. So what is done here, as you look at this model, is the friction between only in this compartment of the knee. The other compartment of the knee is nice and smooth. So what is done is only this compartment is changed. So what is changed with this is you just resurface the area which is actually damaged. So and the resurface the lower portion that is damaged. So which we remove this portion of the lower portion of the tibia, and what is replaced by a small alloy of cobalt chrome and another cobalt chrome alloy at the base plate, and the medical grade plastic is inserted between the two surfaces, and this movement becomes smooth and glistening over a period of time. So this gives relief and gives fantastic relief. Again, this is a minimally invasive surgery, and since all the ligaments and the other part of the knee is preserved and they are natural and they are glistening, so the feel of the knee is much more natural, and we have now enough reports across the world, these things lasting for even 20 years. They're actually slowly surpassing the results of a traditional total knee replacement. We just spoke about the partial knee replacement, but when we see the arthritis is confined to all the three compartments, so there's no point changing only one part of the knee. So that's when we come to a total knee replacement. So that's what will give the patient long-term relief. Again, this is done through a minimally invasive approach, a muscle sparing approach, so the recovery time is much faster and much shorter. Right. So here we look at this model. If you see this, the whole knee is damaged, the inner compartment, the outer compartment, the whole knee is damaged. So what is done here, again a resurfacing part. So only the damaged portion of the cartilage and the bit of bone is removed like this, and we change the whole thing off. And this is replaced with a cobalt chrome alloy base plate and a medical grade plastic. Again on the femoral side is again a cobalt chrome alloy which is fitted across. This is fitted to the bone with bone cement, and this gives you lasting movements and comfortable movements across life. If you or your family members face knee pain or hip pain in their day-to-day life and they need a consultation with me, they are most welcome to contact us through HKS Clinic or through Lybrate.com.